It's been my observation, and I hope that you might agree that our healthcare system is sort of rushing toward the point of unsustainability, at least from a financial perspective. I mean, the costs of care just continue to go up, and in the wake of COVID, hospitals now have massive personnel shortages that have driven the costs of staff up, ridiculously. And you couple that with, the inflation from the overall economy, and hospitals, which, typically had been thought of as recession proof, are suffering even more than they used to. And ultimately they'll end up passing those costs on to consumers. So, what it means for us, I would say, is that we have to keep evolving and adapting. And the only way out of this, this rush towards, unsustainability is through incremental innovation. Innovation not only to lower costs, from these efficiencies that we gain, but also to discover entirely new ways of looking at the problems. We're going to have to make some changes to the way that we, to the way that our system is structured. I mean, unfortunately, our system is structured in a way right now where you've got three entities. You've got patients and payers like insurance companies, and you've got the providers that deliver care. And in a normal, efficient market, the person who's paying for it is also the person that consumes the good and makes the decisions. But in healthcare, it's not the case. You've got these three different entities that only have one part of the equation. So it makes for a very inefficient market. And we're going to have to use innovation to find a way to to get beyond that and to solve the nature of those problems. And that's going to require being flexible. I mean, healthcare is complex when compared to other verticals, and new challenges are popping up all the time. And so, our ability, to be nimble and ready to tackle whatever comes our way, whether it's, changes in policy, which often, cause sea changes, like when HIPAA was first introduced, or when the, Affordable Care Act came, et cetera, as well as the discoveries that drive, the new best practices for physicians and new patient expectations. So, and AI is a great way of maintaining this flexibility.
Yeah, I think one of the things I'm most excited about, besides the flexibility, is the speed. Healthcare is not generally known for the speed at which it, transitions or adapts or
Right.
brings on new technology. But we're seeing definitely, sure, there's always going to be the skeptics, but we are seeing some open-mindedness with people seeing how they can do things like get their head around some complex data with the use of AI. Like we have an AI called Arden that, with a simple question, a operating leader, a perioperative leader, can understand the inefficiencies in their scheduling and fill them. And that translates to often millions of dollars in new revenue or even margin. And when these not-for-profit healthcare systems are grappling with rising costs and they are on razor-thin margins, something like $4 or $5 million new dollars discovered within their hospital walls that they don't have to do too much to get is really life-changing, both for the hospital and the patients it serves.